Hey everyone, just give us another minute or two and then we'll start. We're just getting everything set up in the back.
Aaron, do you have that that record feature? I just want to make sure if you want it recorded that we get that. Cool.
Yes, I do.
Okay.
Sorry for the delay, everyone. We're just trying to get our last panelist onto the panel function. We'll start in just a second.
I'm making sure you guys see her message, right? Kadisha's.
Yeah, I don't know what's, yeah.
Is
Yes.
it Kay did? Is that?
Yes.
Great. Okay, she should be there.
Thank you. Oh my gosh. I've been on since 45 and I'm on a different link. But it said it's waiting for 4 o'clock, so I was confused. Oh my gosh. I'm so sorry.
Erin, are you going to take me off?
You can also just turn your video off for the moment and I'll pull you. Okay, so I think we're ready to start. Thank you everyone for joining and sorry for that slight delay at the very beginning. My name is Erin Kelly from Prescription Home, and I first off want to thank our partners at HomeWorks for partnering with us in this event and helping us to pull it together. Today we're going to be having an amazing panel discussion about the impact of housing instability and homelessness on young children, pregnant people, and parents of young children, and what we can do about it. So we we're about to launch a quick poll just to get a sense of who we have in the audience today and get a sense of where you're from. And in the meantime, I'll note that by this point, I'm sure many of you have been on a Zoom webinar before, but to review, we're on the webinar format, so we can't see or hear everyone who's attending, but you're able to access the chat and the QA. We'd appreciate if you could use the QA for questions specifically for our panelists and the chat for any general comments or conversations amongst yourselves. And feel free to introduce yourselves in the chat now or at any point throughout the conversation. We're going to spend the first half hour or so of our time having the panel discussion, and the second half of our time going through questions from all of you in the audience. And again, please use the QA at any point in the conversation, and we'll loop back to those questions for the panelists during that part of our discussion. If you're having any technical issues, feel free to message me in the chat and we'll try and figure it out. We're also live streaming this from YouTube, and we'll drop that link in the chat in case you want to share that with anyone in your network now. And so without any more from me, I'm excited and delighted to introduce you to our moderator today, Nikita Stewart. Nikita is an award-winning journalist and currently is an editor at the New York Times. She's covered a range of social service and mental health topics during her career, including housing instability and homelessness, and is the author of Troop 6000, the Girl Scout troop that began in a shelter and inspired the world. She'll be moderating our discussion, and we'll introduce our fantastic panel now. And
Okay, okay, great. Thank you all for joining us. There seems to be a big crowd here today, and I'm glad that we're going to be talking about this topic, which is so important. So first, I'm going to introduce our panelists. We have Khadijah White Davis, and she is an advocate for people experiencing homelessness, and she's an expert on housing instability. Dr. Beth Shin is a researcher. She's studying how to prevent and end homelessness and creating opportunities for groups that experience social exclusion. She conducted the Family Option Study, which I'm sure she'll be telling us more about later, but it looks at the long-term the effects of long-term rental subsidies for families experiencing homelessness. We also have Dr. Suzette Brown. She is Chief Operating Officer of Strong Children Wellness in New York City. She's a pediatrician and a health services researcher, and she looks into a lot of different areas, but specializes in mental health and primary care integration. We also have Erasma Beres Monticello. She's an activist and co-founder and executive director of a group called Power of Two, which nurtures the potential in every child and family by empowering them to transform their own lives and their communities. So let's hop right into it. I would like to start with Khadijah. During the pandemic, we saw that between home and work and school, moms and all parents have to juggle a lot of priorities. But I'm hoping you can tell us what's unique about the impact of housing instability on parents of young children and people who are pregnant.
Hi, I actually said I'm Khadijah. Right now, I'm not in the shelter, so I just want to make that clear. I was in the shelter, and right now my daughter is 5 years old. So what I can tell you, with being in the shelter is a lot of hectic things. You live around a lot of different people, and you have to go in and out every day, signing in and out. You feel almost like a prisoner. It might sound like, oh, you have a home, you're going in free, but you're almost confined to a small cage, if you will. And they come in and they check when they want to check and come in when you're not there, things like that. And for a kid to see that, I think it looks kind of weird. If I was a child and I was like, why is this happening to me? Why am I living this way? Why do I not have my own space? Why don't I have my own room? That's what I would ask myself if I was a child. I think for a child, it's good to have their own space, especially with like say with learning and things like that for school, to have your own space, to have your own setup, to have your own like little, it had to be a classroom because right now we're in the pandemic. But own little corner that you can call yours. In a shelter, you can't really do that. You can make a little thing, but it just doesn't feel like home. You feel isolated, you feel depressed and a little bit confused. To be a mom in a shelter it's a lot because I live so far from my job. At one point, I had to actually be let go from my job because I live so far. My daughter's going to daycare in Brooklyn. I was working in Manhattan and they put me all the way in Queens, and I told them at PAC, I'm too far away, but they didn't make any, resolve for me. They said, where you are, what we have right now, we can give you. And I was like, I took what I can get. I didn't want to be on the street with my child. No mother wants to be on the street with their child. So they take what you can get and you kind of work with what you have. And for my daughter, it was a lot to wake up at 5 a.m, to go through traffic, to be going to daycare and things like that. It can be, you might say, oh, a child doesn't know, but a child knows when stuff is wrong. Children know when even if their mother doesn't show it, they can sense that the child, your mom is like, something is off with her. If you know her for being this kind, loving, bubbly person, and all of a sudden her mood is different, children can feed off of that. And the thing about it, your energy and how you are affects your child. You might think, oh, my child is fine, but no, your child is feeding off the way that you are initially. So I think being in a shelter and not having a stable place and not having a place with you're turning your own key, it can affect your child in many ways. And you don't even realize. You think, oh, yeah, Sarah, Susan is fine. But really, if you're not fine, that means your child's not fine because they feed off your energy. So I don't want to take too long, So that's my 2 cents about that.
Thank you. Thank you for sharing your story. In 2017, I covered homelessness and housing instability, but I really in 2017 began focusing on children. And, I began following the Girl Scout troop that had been founded in a shelter. And that year, I also followed a pregnant mother through her last trimester and the birth of her son, and really tried to explore what the developmental effects were on children. And at the time, there were some researchers at Columbia who were just starting their study. Dr. Brown, I wonder if you could tell us what the developmental effects are on children, as Khadijah was explaining about children being, confined to this limited space and also going back and forth for appointments, et cetera.
Absolutely. So Khadijah really highlighted the impact of housing instability and homelessness on both parental health and mental health, and the child's health, mental health, and developmental well-being. And, there's been a number of studies that show that housing instability and homelessness in particular have profound impacts on a child's development and on their physical health and their emotional well-being. We know that growing up in a stable housing situation is the most optimal for brain development and physical health. And when you're moving constantly, when your housing situation is unstable, that leads to what's called toxic stress. And when that toxic stress is left unchecked for a prolonged period of time, it can have profound impacts on the way that the brain develops. And it can also lead to elevated levels of stress hormones like cortisol, that if there's no buffer to sort of bring those stress hormones down and back in check, can also have significant effects on our physical health. And there are countless studies that show that toxic stressors, or what are often called adverse childhood experiences, or ACEs, that if those are experienced for a prolonged period of time, there's an association in adulthood with conditions like cancer and heart disease. There's also associations for kids with neurodevelopmental issues like ADHD, and of course, a number of behavioral health issues. So, homelessness, again, is a major toxic stressor for the reasons that Khadija outlined. And without sort of the buffer of stability, it can have substantial effects on child and parental health and well-being and development.
Thank you. I know that a lot of the attendees are also in the field and studying, but I think it's important to go ahead and say that when we are talking about homelessness, we're not just talking about being in a shelter, we're talking about overall housing instability, being in overcrowded situations, and it runs the gamut. So Ms. Barras Monticello, I was wondering if you could also answer the question about the developmental, the effects on the development of children. What have you found with your group?
Yes, thank you. First of all, Khadija, thank you for sharing your personal story. And as Dr. Brown said, a lot of this leads to toxic stress, right? While facing housing instability, the stress and the pressures felt by families trying to stay in their homes or trying to get out of the shelter system and into permanent housing creates undue trauma that permeates all aspects of a caregiver's life as well as their child's life. And as Dr. Brown mentioned, this has neurological impacts, right? And so these stressors, this toxic stress, whose impacts are most keenly detrimental during the first 1,000 days of a child's life. And it's during these all-important 1,000 days that children's brains are developing exponentially, which is where responsive parenting and the fundamental work that we do in my organization is really most effective and protective. And so when parents are inundated with procuring housing, with living in the shelter, and with managing the interaction with not just with the shelter system, but with other systems like the Human Resources Administration or ACS, for example, those stressors become incredibly overwhelming. And make it really, really difficult for parents to fully engage and interact with their children in responsive ways. And so we know that without these protective buffers, a lot of this can lead to detrimental outcomes, including depressive and anxiety disorders and difficulty for children to meet their developmental milestones. Importantly, children facing housing instability or long-term shelter, existence exhibit higher suicidality rates than children who are living in stable housing. And so the detrimental effects also play out in expectant or postpartum mothers facing housing instability as well, because mothers who are expectant often miss all important prenatal appointments that provide sonograms or prescriptions for prenatal vitamins, the building blocks to ensure healthy and fetal development along the course of their pregnancy. And so the lack of all of these things, the intersectionality and the interaction with all of these systems can be detrimental to the entire family, as well as all of these systemic issues that we're contending with, which also include the lack of available parental leave, which also means that parents cannot adequately be present to meet their own needs and those of their children.
Thank you. Dr. Beth Shin, you obviously know a lot about this, but Ms. Barras Monticello and Ms. White Davis, they touched on the effects on a parent. Can you talk a little more about that, on the effect on the health and the emotional well-being of a parent?
Mm-hmm. Absolutely. And those are very important. I mean, families who experience homelessness are at the lowest point in their lives. And if you talk to them while they're in shelter, you see higher rates of psychological distress, some substance abuse, some domestic violence, which sometimes brings people into shelter. But if you give families housing vouchers, if you hold families rent to 30% of your income, of their income, you see that psychological distress goes down in the moms, and substance use goes down in the moms, and domestic violence goes down, and foster care placements and separations of kids from parents go down. And there are improvements for kids too, in school attendance and fewer school moves and fewer behavior problems and less food insecurity for the family. And so simply giving people access to housing that they can afford has all of these psychological benefits, and it affects some of the things that can sometimes lead to homelessness. So the effects on parents are really important as well. And as Khadijah said so well, those are transmitted to the kids.
Thank you. Ms. White Davis, I'm wondering if you can tell us about, how you think the pandemic and COVID has affected children and their families who are in shelters at this moment and experiencing housing instability. What have you found?
The things that I found is that a lot of people are going homeless in a big amount because they can't afford their rent. Even though they said, oh, you can't do evictions are still happening. Let's be honest. Especially if you don't have a lease, they're not supposed to kick you out of a place like that, but they do it anyway. That's what happened to me. So in the pandemic, I think with schooling, I think it's affecting the kids a lot. Being in the shelter and not having space to do proper schoolwork, especially if you have more than one kid. But one kid is more easier to handle, in my opinion. But when you have more than one kid, it's going to be harder because the teacher's talking and the kids are, it's too much noise. From the parent standpoint, I think it's a lot because in general, being in a shelter like myself, I was depressed. I was really in a dark place and I couldn't do much. But being locked in your confined space all the time, and you really can't leave out because it's really honestly not safe to be that much outside unless you're really apart from people, can be a lot on the parent. And I think emotionally, everything about it is just bad because you need space. You need space from where you're living. You need space from your kids. You might love your kids to death, but to be with them all the time like that in a small space can drive you a little crazy, to be honest. Nobody unless they have a big house, a lot of space, and a big backyard, can say, yes, I had the best time during quarantine with my child. They're going to drive you a little bit crazy, especially if technology is not working, Zoom is not working today, and you want them to get the best education. And already we know that shelter kids usually don't get the best because people don't give them the best. People forget about them like they're not important when honestly they are important. They are still our future at the end of the day. So I think all of those things and not be able to do certain appointments because of COVID. What I understand from people I talk to in the shelter is that a lot of things are through Zoom, and if Zoom is not working for the employee, then how can they get it? If they don't have a phone, if they don't have internet to talk to the person, that means their case is going to be backed up even more because they can't do their proper paperwork and stuff like that. And that can affect you. If you're trying to get out of the shelter and being in there is making you already confused, and then you have to work with technology was not working. And in some places, because of the way the buildings are made in New York, the internet doesn't work that great already before the pandemic, with everybody being on it at the same time, it makes it disaster. So the pandemic has really hit home for a lot of families, and between not having a home and not having internet for your children, also even to find a job, it's easy to go over the internet at this point because people really don't do storefronts anymore, going place to place to look for a job. Everything is online. To have your kids talking, you're looking for a job, you can get a bit of a headache, I would say. So I think that really hit them a lot, and just not be able, like, a lot of things are shut down, so they can't do it as they would like to do to make themselves better. And that could be very depressing and it can be a lot for a parent and a family to go through. So I think that's what I think about the pandemic. And
Thank you. Thank you for sharing. Last year, at the beginning of the year, I was still reporting. And one of the first stories I wrote out of the pandemic was the fact that so many shelters in New York City, pretty much all of them, were not equipped with the internet necessary that children needed to learn. And not only that, the children didn't have their devices. So it was an awful situation that I know other places around the country experienced. You know, we know parents were like driving and walking to sit in front of libraries to capture the internet from there so their children could, you know, complete their studies. Dr. Brown, I'm wondering if you can also chime in here on the effects of the pandemic on an already difficult situation.
Yeah, I think both you and Khadija hit on some major points and highlighted some of the, primary impacts that COVID has had on, both housing instability for parents and kids, and then also the direct impacts on kids and parents. I think, as a pediatrician, what I have been seeing, and I think my colleagues have been seeing, are just tremendous stressors related to financial strain. And, rates of food insecurity have skyrocketed. So many parents lost jobs during the pandemic. Lots of families, unfortunately, lost loved ones to the virus. And so they're facing this tremendous toll. And again, toxic stress, what we, Erasma and I mentioned earlier, has really been something that these families are challenged with right now. And, I think that the threat of eviction for many families who've fallen behind on rent or their mortgage payments are the threat of foreclosure is real. And a lot of parents are really, having a hard time trying to juggle all of these stressors and these competing demands. I think both you and Khadija highlighted some of the challenges of remote learning. That's even more difficult during, if you're living in shelter, and like you mentioned, Nikita, your Wi-Fi access isn't optimal. And a lot of kids don't learn well remotely. They learn better in a classroom setting. And they've struggled to keep up academically. They've fallen behind, they've regressed. So there have just been tremendous impacts. I think another thing to highlight is that, particularly in marginalized, communities of color, who may have been living in more overcrowded housing conditions pre-pandemic and during the pandemic, it's really difficult to quarantine safely in your home and socially distance, and when you're living with multiple other people in a household. And so the high rates of COVID infection that we were seeing in communities of color, there were many factors that contributed to that. But one of them was living doubled up and living in, an overcrowded situation where you couldn't, socially distance appropriately from a potentially infected household member. So, COVID has had tremendous impacts on kids and parents, and has definitely affected people emotionally, physically, financially.
Thank you. Thank you. With the pandemic, and rightly so, a lot of attention was paid to the single adults who were living in congregate settings and needed to be moved to areas where they could spread out and not be exposed to the virus. But we know that in New York City, most people experiencing homelessness are actually families with children. And that's, in temporary emergency shelters and doubled up. More than 60% of the people, are children and families. So I'm wondering if everyone can address why there's this perception that, you know, homelessness is only the person you see living outside or on the subway, you know, and people don't think about families with children. Why is this perception skewed, and what's the impact of these misconceptions? Maybe we'll start with Dr. Beth Shin.
Okay. Well, families do everything they can to be off of the streets. You know, a parent with a young child doesn't want to be sleeping in the subway or on the street. They're doing everything they can. And that often means doubling up with other households, as Dr. Brown talked about, and creating additional risk for COVID there. Nationally, there are more individuals who experience homelessness than there are families. And the media pays a lot more attention to people who are out on the streets than they do to people who are behind closed doors. And so families are trying to stay hidden, and the public perception is what's in front of them. And I think that's exacerbated by the media and the national scene that's a little different from the scene in New York. New York has a right to shelter, and it may not be the optimal place to raise a child, but compared to some other cities where you might have a 30-day limit on your length of stay in shelter, or where you might have a waiting list just to get into shelter, the New York situation is a little better. It means that in New York, the folks who are on the street are overwhelmingly single individuals.
Okay, who wants to jump in next?
Sure, I'm happy to. You know, it's interesting, the question, because Women in Need actually conducted a survey, maybe last year or the year before, asking New Yorkers this very question about, you know, who do they perceive to be homeless? And it was really interesting because 62% of respondents said single adults. And when they were asked about, you know, what about families and children in shelter, and overwhelmingly, you know, people were scratching their heads, right? So they said, you know, actually below 35% of the respondents said, you know, that it was possible for family homelessness to really exist in New York, because they don't see them, as Beth was saying, and as you mentioned, Nikita, they're not seeing them on the streets, right? And so the reason for this, Beth mentioned already, but there's some other reasons why this is happening. And that is that, first of all, the tracking system, right? So the way that, you know, HUD, which is the Department of Housing and Urban Development, tracks or captures the number of people on the streets and in shelters is in one night, right? So the tracking system is for one night. And that is challenging, because what that does is that the only way that a family can really be counted is if they visit PATH, which is the city's centralized like intake site, which is in the Bronx, and then are approved for shelter and then are assigned to one. So if they're not tracked in that specific night, then that's one number that's not included in the tally of homeless families. The other reality is that there haven't been a lot of studies or research that has been done on the impact of homelessness on families and children. And so the emphasis, as Beth was mentioning, has been primarily on single families. And so the impact of these misconceptions have led to an underinvestment in addressing family homelessness, right? So we must raise public awareness of family and child homelessness by having dialogues like the ones that we're engaging in right now, but also conducting public education campaigns to really make New Yorkers aware that it's not just a single adult issue, is a more complex issue, which also includes families and children.
Does anyone else want to address the misconceptions?
Let me throw in one fact that people are not aware of very often. The age at which you are most likely to be in a homeless shelter in the United States is infancy. Homeless families are young, they have young children. Having a child is a blessing, but it also is costly. And it takes a family member out of the workforce to care for that child, or requires the family to pay for childcare for that child. And so moms with infants and pregnant moms are especially vulnerable. And that's actually a national statistic, not only a New York City statistic.
I just want to put my little 2 cents in. So like it was said earlier, media definitely makes you think that homeless people are living on the streets. And I watch a lot of YouTube channels, and you look at like California has a big homeless population, from what I understand. And you think of tents, you think of a homeless person not clean. You think of a man and a woman on the street just sleeping on a sleeping bag. When honestly, it might sound kind of, out there, but most time homeless families make homelessness look better than it actually is. Because most times you can't even tell that they're homeless. I was at my job working at a school, and people didn't know I was homeless until they found out. It's like, you're homeless? And to me, before I became homeless, I thought you had to look homeless and smell homeless. That's what my idea of homelessness was. And being homeless, I always thought to myself, do I look homeless? Do I smell homeless? I always want to make sure I was smelling clean. My daughter looked right, because when you look right, you feel better. Even if you're still struggling, people who are the most depressed people in the world, and they just put a smile on their face and just like, they put a little makeup on and pull a little this, they put this stuff together, they feel a little bit better. You know what I'm saying? So I think, honestly, most time people don't think about families because they don't see them unless they're begging on the train, which is very, compared to New York City, compared to like people who are a man or a woman, most times you do not see a family asking for money. I think since I've been here all my life, I've probably seen about 2 or 3 families asking for money on the train. And I've been on the train a lot of times. It's usually like a single young person, a woman or a man asking. So people don't think of, oh, a homeless person could be a whole family. It's possible, because you could be homeless about a lot of different things. Your house could have went up in flames, or you could just have lost your house because of you couldn't pay your rent, or just different things. A hurricane could come through, your house is gone. It could be many different things, but people just don't think about homeless families at all. But I'm gonna leave it there, and I take up all the time.
No, thank you. Thank you for sharing, because that is definitely true. I know I found that. And also, children unfortunately have to deal with the stigma. And because it's hidden and we don't talk about it, we certainly don't want to, I want to say, normalize it, because I think what we want to do as a society is normalize housing. But if we could just erase the stigma, that would go a long way. So before we open it up to questions and answers, I heard someone say something about the underinvestment in families with children. And I know someone talked about, it was, in other areas around the country, you have a limit on the amount of time you can be in a shelter. But I think we also need to talk about the limits of rental assistance and direct cash transfers. So I'm wondering if Beth and Erasma, if you can tackle that for us and explain direct cash transfers and housing vouchers and what needs to be done to increase them, leverage them, start them, whatever needs to happen to put a dent in homelessness.
Beth, I'll defer to you.
Sorry, getting my mic. So we know that long-term housing vouchers that you can renew indefinitely as long as you're eligible, end homelessness for most families. They prevent homelessness for people who are poor and potentially at risk of homelessness. And it's a really interesting question whether some shorter term assistance can help. The rapid rehousing program that gives families and single individuals shorter amounts of assistance tends to stop them from coming back to shelter, but it doesn't stabilize them. It doesn't give them stable housing over a period of time. And one important thing to try that we're hoping to try in New York City is unconditional cash transfers that families can use in whatever way they think best. A housing voucher is only in an independent apartment that passes a housing authority inspection, maybe with some cash that's not tied to rent. You can make an arrangement with the family that you're staying with to make a doubled up situation more tolerable and more possible. Maybe there are other things that you can do, such as childcare, that will enable a parent to work. Unconditional cash transfers put the parent in the driver's seat. Let the parent decide what it is they most need to do the best by their families. And so we think that's a really exciting thing to try.
Yes, no, I agree. Actually, there was some research that was done by the New Leaf Project in Canada, and then it has been done in parts of California and Ohio, where people received a one-time cash gift of about $7,500. And this was like benchmark against like a public assistance rate. And so basically what it did was that they gave this directly, this one-time lump sum, which was directly deposited into a no-fee checking account. And the researchers tracked, basically collected data on people who received this one-time lump sum over the course of 12 to 24 months. And what they found was that people who received this cash, this lump sum, were able to move more quickly into stable housing, spent fewer days in shelters, and were able to retain over $1,000 throughout those 12 months. And so all that to say is that it works. We also know that housing vouchers actually also work. Now, the challenges with the housing vouchers in New York City is that although we give these to, and I believe, Beth, and you can correct me, they're called City FEPS vouchers, which families receive, a lot of the families that receive them are still homeless, right? And that is because the rent limits are too low when compared to market prices. And so what we need to do is actually create a system in which all of these different programs and services and agencies are interacting and communicating with each other, right? So we need to make sure that the vouchers are market rate. We need to make sure that the landlords are not routinely rejecting these vouchers, but they are accepting them. We also need to think about, as Beth was mentioning, these cash direct lump sums to families, because we know that all of these things work and they can work simultaneously.
It seems like Khadijah wants to jump in. Okay, all right, just making sure. Okay, so, I want to get into some of the questions from the attendees. Someone asked, it seems like, and I can definitely attest to this anecdotally, that when there is a pregnancy or a new child is born, that's when families are likely to become homeless. And so they're like, why is that? I know on the forms, I think the city checks off overcrowding and family discord. So why does that happen? Why is the birth of a child or an expectant mother, why is that the point that they become without housing?
So the home-based prevention program recognizes pregnancy as one of the risk factors for homelessness. And we've known for a long time, both in New York City and nationally, that pregnant women are more likely to become homeless, and women with infants are very likely to become homeless. So pregnancy is a kind of stressful time for an expectant mom, even if it goes beautifully, and it doesn't always go beautifully. And so the mom is about to expand her family. She may be a less welcome tenant in the household in which she's doubled up. She may need more space when the new baby comes. And then babies cost money. They outgrow their clothes every time you turn around. They need special food if you're, even if you're breastfeeding, then the mom needs some additional food. The WIC program is very helpful there. But the most important cost is probably taking, is the cost of care, whether that's care that's provided directly by the mom, or whether we're a dad or another family member, or whether it's care that's paid for. And either way, that's costly, and young families are not typically at the height of their earnings. And so that extra cost of pregnancy and of having a young child can pitch a family that was hanging on into homelessness.
I just want to add to that in addition to what Beth said, parental leave, right? A lot of our families are essential workers, they're home health aides, they may be working in restaurants, et cetera. And guess what? They don't have parental leave. And so if you don't have parental leave, you're expectant mother, you're about to have your baby, you lose your job. Right? So there's no income coming in. And so that is when we're most vulnerable. And we see this across the board, and we see it, primarily happening with who? The majority of our people, right? So BIPOC community experiences this disproportionately than our white counterparts, right? And so that is the truth. We don't have universal parental leave. And so that makes it incredibly difficult for our parents to take time off, still receive an income, and take care of their growing families.
And I just want to add, I don't have data to support this, but anecdotally, pregnancy and the first few months after birth are, as Beth mentioned, extremely stressful times. And a lot of times couples have a very difficult time with the changes that come along with having a new addition to the family. And, a lot of couples don't sort of survive that time as a couple. And there may be domestic violence, unfortunately, that leads to the separation of that family and leads, a new mom into a shelter, or, one of the members of that couple may choose to leave, and that leaves, a single parent, unfortunately, raising a young child, and who no longer has that support of that second parent in the same way that they did before. So I do think that may also be contributory.
Thank you. Erasma, you mentioned BIPOC and also universal care. I'm wondering, what other areas, how does structural racism affect what we're seeing with homelessness? Who wants to jump in on that first?
I'd be happy to try. I think there are 4 kinds of pathways that structural racism takes. One is discrimination in income. And we know that if you send out resumes that say Lakeisha or Emily, that the difference in callbacks is worth 8 years of experience, that Emily is just more likely to be called back than Lakeisha when those names are just put onto resumes. There's discrimination in housing. It's been illegal since the 1960s, but it continues. There is discrimination, historical discrimination, that has stopped Black families, Native American families, Latino families from accumulating wealth that their white counterparts were able to accumulate and to pass on to the next generation. And then we have the high rates of imprisonment. And imprisonment, especially for African American males, takes fathers out of families, it takes earners out of communities, and it also contributes to homelessness. So I think those are 4 of the ways that African Americans, Native Americans, and to some extent Latinx peoples are put at greater risk of homelessness.
Anyone else? Although I guess I want to get to some more questions because we have a lot of them coming in. Let me see what this question was. It was a good one. We are in an election. And so for the incoming mayor, what's one thing, although I don't know if it could just be one thing, what are like 2 things that the incoming mayor could put in place to, help end family homelessness? Right.
I'm happy
Okay.
to jump in while my colleagues collect their thoughts. I would say, and a colleague and I wrote an actual op-ed about this directly to the mayoral candidates, where we talked about applying some of the lessons learned in reducing veteran homelessness, right, to addressing family and childhood homelessness, which means providing safe, affordable, quality childcare that works for people that have non-traditional work schedules, like what I mentioned before, including nights and weekends. Streamlining the ways in which to connect families who are experiencing homelessness to affordable apartments, through those vouchers, and making sure that the landlords that are part of the HUD system are cooperating. Also, broadening the eligibility requirements for those housing vouchers, right? And really thinking about setting up children of color for success by ensuring that there's flexibility in accessing early learn centers, childcare centers, et cetera. So it's a combination of things that need to happen, in addition to coordinated strategies and communication between all of the agencies that families and children interact with during while they're experiencing homelessness, right? So we're talking about the Department of Homeless Services. We're talking about the Human Resources Administration. We're talking about the Administration for Children's Services as well. So all of these agencies need to communicate and need to be working in tandem to provide the support systems at all different levels to ensure that we can address homelessness holistically for families.
I completely agree with everything that Erasmus said. And what was mentioned earlier too about increasing the vouchers to sort of reflect market rate so that landlords will be more willing to accept them is also really important. And I would add to sort of, systems being better coordinated to more holistically address this issue. I would add healthcare to that list of systems. I think, somebody actually raised a really good question about how healthcare can sort of play a role in this as well. And I think that, there's greater recognition among healthcare providers that social determinants of health and homelessness and housing instability is a huge social determinant of health, that that drives health outcomes. Actually 80% of health outcomes are driven by social issues like homelessness. And healthcare has a role to play in terms of identifying housing instability and homelessness and screening patients who come into the office for preventive care, for example, for housing issues and housing concerns. And then once an issue is identified, it's not enough to just identify the need and the issue. As healthcare providers, we need to know how to make the appropriate referrals and connections to resources that help families. And, you know, my practice and is a little different in that we embed our practice into community-based organizations that are expert at addressing a lot of these issues. And we recently forged a really critical partnership with Riseborough, you know, which is an amazing organization that focuses on how to end homelessness and on eviction prevention. And we recognize that, again, you know, it's not enough to identify this issue among our families and patients. We have to connect them to resources that can help. And organizations like Riseborough, other organizations that offer home-based programs to prevent eviction are critical. We also should be using our voice as healthcare providers to advocate at the state level and at the city level for more services and resources for our families.
Thank you. You know, I know we're based in New York City, but there are folks out there who do want to understand, like, what should the federal government be doing? Like, how are the city and the federal government supposed to be working together to help end homelessness? Someone, you know, one of the attendees actually had some very specific questions, like, you know, should there be like a rental assistance program through Head Start and Early Head Start, or should the Department of Education have its own rental assistance program? I don't know. I'm not a government official, but maybe you all can better tell us what the federal government should be doing.
Well, at this point, only about 1 in 4 households that are eligible for housing choice vouchers, which is the major form of rental vouchers that the feds provide, only about 1 in 4 households get those. So the closest thing we have to a silver bullet to end homelessness would be for HUD or for Congress to fully fund housing vouchers for all households that are eligible. And that would make a tremendous difference and allow homeless services to focus on the much smaller subset of folks that need some additional help. We could also have national legislation prohibiting landlords from denying a lease to someone simply because they're paying for that lease in part with a subsidy or housing voucher.
What I think, it might be wishful thinking, to be honest, and I know what I'm going to say is going to cost a lot of money. I think they should do it with state by state, and even New York probably even different, because New York City is much different than upstate New York and how much like things cost and things like that. I think they should do it based on how much a person or a family makes and based on that number. So I think a lot of families should just qualify. If you make under $50,000 a year and you have like 3 kids, maybe you need a little bit of help, because at the end of the day, you have to do savings, you got to buy clothes for the kids. So I think you should put a cap at like how much a person makes, with also how much kids they have and the ages of those kids. Because depending on what a kid is in that age, they might need more or less money. When a baby is much younger, they're gonna need different things, bottles, Pampers galore, like certain things they're gonna need more. A 5-year-old and a baby might need different things, and a 5-year-old might need less money. As they get a little older, the teenagers, they might want name brand, probably want to splurge on that. But you still want your kid to look good going to school. So I think it depends on how much you make, and probably you think the person will put some in savings and things like that, and help everybody. Honestly, at this point, especially the pandemic, needs help. So no matter what, like if they're not wealthy, they probably should get help from the government. To be honest, it might be a lot of money, but I think that's what make us right now be a little bit better in America.
Oh wow! Can you run for mayor?
I wish. I really wish.
Okay. Well, I believe it's going to be time to wrap up. I want to thank the panelists. I've certainly learned a lot today. Are there any parting words you all would like to say before we end today? How about Dr. Brown? I
No,
guess,
think-
what do you want people to take away from this? What should people know about, babies, and how are we going to get to 0 babies born homeless?
Yeah, I think that all of us, have a role to play in ensuring that, the kids and families that we may serve or interface with grow up in environments where they can thrive and achieve their full potential. And so this is an issue that affects all of us, I believe. Even if, we may not be directly impacted, these are kids are our future, and we have to all play a role in ensuring that, they achieve their full potential. So I think that forums like this are extremely important, that there are ways for all of us to figure out how to play an advocacy role. And I'm hoping that that will be shared at the end of this discussion today with folks who've been participating. I think, again, to get to 0 babies homeless, we have to put the pressure on political leadership and others to really make the necessary investments to prevent homelessness and to get families out of shelter much more expeditiously. And it's going to take a lot of different systems, as Erasma and others mentioned, working together, and a lot of folks really, again, putting the pressure on our leadership to make this happen.
Aaron has put a great call to action in the chat.
That's right. I think to add to what Dr. Brown said, we need to remember, right, that 95% of the shelter population are Black and Latinx, and 69% are headed by single mothers. So this is yet another example of the impact of racist policies like Jim Crow, like redlining, that have had, right? All of these racist policies have had a direct impact and continue to have a direct impact on our BIPOC communities. And so to truly, really eradicate child homelessness crisis, we need to look holistically at all of the intersecting issues and the barriers inherent within them.
Yes, I'm gonna let Khadijah take us out today.
Yes. I just want to say, don't judge a person based on where they are, because honestly, in the next couple of years, they could be a boss. You just never know. So treat people as they should be treated and make a difference in somebody's life. If you see somebody is down and out, if you don't even have saving the money, just be a helping hand, or just in other ways, or even being an ear to listen to their problems. Just be a good person and make a difference.
Oh, wow. Thank you for that. We really appreciate it. Thank you. And I think that's it. Erin?
Yeah, thanks everyone so much. Thank you, Nikita, and all of our panelists. It's been a fantastic discussion. I put a Google Doc in the chat, and I think Jordan upped it as well, with just all of our information if you want to get in touch with anyone or hear about us. And we have an event next week talking about the mayoral candidates platforms that I think everyone would learn a lot from. And so I hope to see you all there. And thank you again, everyone, for your time. It's been a great discussion.
Yes, and remember, I am a journalist, so yes, we'll be on top of that. So thank you very much.
Thank you. And Khadijah, tell us when you're running. I'm ready to vote.
I would try to go in, follow me on YouTube. Maybe I will one day. You never know. Anything is possible.
I'm here for it. I'm here for it. All right. Thank you, everybody.
Thanks, everyone.